The purpose of this video is to demonstrate PEG tube enteral feedings and medication administration. In my assessment phase, I'm going to assess doctor's orders, facility policy for verifying placement, if it's required, patient allergies, nurse's notes for any previous enteral feedings and medication administration, assess lung sounds. I also want to assess any abdominal distension, bowel sounds, and any nausea or vomiting. In my planning phase, I will plan for medical asepsis. I will also need to gather my equipment, which includes a stethoscope, a pair of gloves, an irrigation kit that also has a 60 ml syringe and tap water that I pre-filled, a Silent Night pill crusher or whatever your facility has to crush your medications, feedings that is ordered, individual medication cups, a towel, and medication that is ordered. You will also plan for frequent oral care because you have to remember patients who have PEG tube feedings are having nothing by mouth, and oral care is very important. I will also plan for assistance. In my implementation phase, I'm going to go into the patient's room. First thing I want to do is introduce myself. Hi, Ms. Jones. My name is Stacy. I'm an ACC vocational nursing student. How are you today? I need to make sure that I perform medical asepsis. Make sure both side rails are up, ×2, and raise the bed to my working level. Ms. Jones, before we begin, I need to identify you. I'm going to have my MAR and I'm going to compare it to what is on the patient's armband. Ms. Jones, can you give me your first and your last name? Can you also give me your date of birth? Are you allergic to any medication? Make sure that what is on the MAR is the same that's what's on the patient. I also need to make sure that I raise the patient up to 30 to 50 degrees. Ms. Jones, what we're going to do today is the doctor has ordered some enteral feedings and also some medications that I need to give to you this morning. Is that okay with you? Okay. Before we begin, I also need to make sure that I provided for privacy. I want to go ahead and make sure that I am assessing my patient's lungs and their bowel sounds. Ms. Jones, do you know the last time that you had a bowel movement? And she may or may not have had one recently, but you want to make sure that your patient has bowel sounds before you ever give any kind of medications or any kind of feedings. First thing I'm going to do is apply my gloves, which are just clean gloves. I'm going to get my towel, and this is just in case if I have any leakage, I have my towel just to protect the patient. Because my patient is not connected to continuous feedings, the Lopez valve is turned to the off position. First thing that I need to do is make sure that I check residual. I'm going to get my 60 ml syringe. I'm not going to have anything in it. I'm going to attach it to the patient, and I'm going to pull back. For the purpose of this demonstration, the patient doesn't have any residual. What you will need to do is make sure that you're assessing the residual. You need to check your facility policy to see how much is too much. I want to assess the residual and aspirate for the color, consistency, and amount. You would hold the tube feedings and medications if the residual is greater than 200 mLs or according to facility policy. Return the residual to the patient because this is the patient's feeding and it also has electrolytes. Turn the feedings off to the patient and take off your syringe. I have filled my irrigation kit with my tap water, which is tepid warm water. I have filled it up to the 300 mark, so that is my beginning count. Before I begin, I need to flush the PEG tube with 30 to 50 mLs of the warm tepid water to make sure that it's patent. Best practice is to do this by gravity. Remove your plunger. It's a little bit easier if you go ahead and get your medicine cup and fill it all the way, which is 30 mLs. Now I'm going to get my syringe and I'm going to attach it to the peg tube. Turn it to the on position and pour my water. And allow it to go by gravity. Then I'm going to come and turn it back off and get ready to administer my feedings. Now it's time to administer the feedings. Make sure that you know the exact amount of how much you're going to give to your patient because this is part of their intake. So according to my bottle, I have 237 mLs of feedings. Again, I'm going to attach my 60 ml syringe to the peg tube. Turn it to the on position. I already have my can, or the lid to my can loosened. And by gravity, I want to go ahead and pour the feedings. Just pour a little bit at a time. Don't let it fill all the way up because if the patient does cough, sometimes the feedings can come out. Mrs. Jones, I'm giving you your feedings. If you start to get any kind of fullness or nauseated or anything, just let me know. I'm going to continue to do this until all of the feedings has been administered. Once I'm done with that, then I'm going to come over here and I'm going to administer 30 mLs of water. Feel okay? Now I'm going to come and turn this off. Now it's time to give medications. See if you can get your medications in liquid form if possible. It makes it a lot easier to administer through the peg tube. I'm going to use the Silent Night, so the first thing I'm going to do is get the little plastic container, get my medications, which I've already done my first and my second check and my third check. Put your pill into the plastic container. And with the Silent Night, you're going to crush your medication. Try to get it as much as you possibly can, but just be careful because if you do it too much, you can put a hole in the bag. Once I've got my medication, then I'm going to get ready to line them all up. Now I'm going to give medication in liquid form. Make sure that you read the label. The doctor has ordered 30 milliequivalents. The medication label says 30 milliequivalents per 15 mLs. So I need to pour 15 mLs. Now I'm going to get my medication ready. You're going to put each medication in individual cups. Then I'm going to pour a little bit of water into each cup. What I'm also going to do is I'm going to make sure that I have another cup that's in between the medications because you have to flush with 10 to 15 mLs of water in between each med. And then I'm also going to make sure that I have 30 mLs of water at the very end. I have all my medications ready. I have a medication, 10 mLs to flush, medication, 10 mLs, medication, and then 30 mLs at the end. One thing I want to make sure to mention to you is if you have liquid medication, sometimes you may not be able to get the exact amount in this cup. For example, say you only needed 6 mLs. You can always use a syringe as well and draw up the exact amount until you get to 6. I've already explained all the medication that I'm going to give to my patient, and now I'm going to administer the medication. Sometimes medication doesn't dissolve very well, so you may have to stir it prior to giving it to your patient. You can bring in a little spoon or a tongue blade, anything that you want to use. For the purposes of the video, all I have right now is just an empty syringe. So I may have to stir it to see if it will dissolve better. If I needed to do another one, I would have to get a different syringe because I can't mix the medications. Now it's time to administer the medication. Okay, Mrs. Jones, I'm going to go ahead and give you your medications. I'm going to attach and turn it to the on position. And again, I'm going to let it go to gravity. Give my medication. Flush. Medication. Flush. You doing okay, Mrs. Jones? And then I have one more medication. Now I'm going to flush with 30 mLs because now I'm done with my medications. And this keeps the tube patent. Now I'm going to turn it to the off position and take off my syringe. Make sure that you close the Lopez valve at the very end. Before I began, I had pre-filled my irrigation kit with 300 mLs of the warm tepid water. Now I have 100 mLs left. That's a total of 200 mLs of water that was given with feedings and medications. Don't forget that you also had 237 mLs of the feedings that you gave. You have to combine the two together, which would be a total of 437 mLs, and that is your patient's intake. Okay, Mrs. Jones, we're almost done. How are you feeling? I'm going to go ahead and take off my gloves. Wash my hands. Okay. Mrs. Jones, because I just gave you some medications and some feedings, I need to make sure that you stay at this position, if not just a little bit higher, for about 30 minutes to an hour, okay? This will prevent anything from kind of maybe coming back up. Do you have any questions for me? I'm going to lower my bed. Are you feeling okay? All right. I also want to make sure that the colite is within place. Okay, your colite is right here, Mrs. Jones. If you need anything, just let me know. Now I'm going to leave the room. Now I'm in my evaluation phase. I need to evaluate the amount, the color, and the consistency of the residual, if there was any. I also need to evaluate my patient's response to the feedings and to the medications, observe intake and output, weight, respiratory and bowel sounds. I also need to make sure that I've evaluated how my patient has tolerated the whole procedure. Now I'm in my documentation phase. I want to make sure that I have my MAR. I will need to document the medication that was given, the feedings that was given. At the very bottom of my MAR, I will sign my name and my title, and I will also put the date if need be. In my nurse's note, I will need to make sure that I'm documenting the residual amount, the color, the consistency, the type of formula, and the patient's tolerance. It's also very important that you are documenting your intake and output for your patient.